So I handle patients' fears or anxieties about spine surgery by really just listening to them and listening to what they're worrying about without rushing the process. In other words, I'm there to listen as best as I can before I start talking. Then, of course, I explain the conditions, the procedures in some simple everyday language, use diagrams, models, videos, whatever it takes to communicate. The best option at that point in time is to talk and communicate. We have to speak up and just exchange words, think logically, express our worries. I have the same worries some patients do. How will you do? What are we looking to do here? And so on. So we review success rates, risks, benefits. We talk about published data, rates of success, ancillary data that's meaningful, and share stories about patients and so on. Whatever it takes to understand the process and have good data as objective as you can. Another thing we talk about, anesthesia, pain control, step-by-step processes after surgery. So you really don't want any surprises even when you're going through the process. Family is a huge help. So if there's family nearby, there's spouses, there's families, there's children, bring them in. We're going to talk about all the alternatives, why you need surgery, why you don't need surgery, just to have clear expectations, set some obvious expectations for ourselves after surgery, answer as every question as you can, try to answer these things so patients can be informed, supported, and hopefully get that anxiety down as best as you can.